Hello, I'm Dr. Ruth Shogay, Chair of ASCO's Diversity and Cultural Competency Committee, and we are happy to offer you our Voices of Diversity project. This project is a collection of stories from your fellow colleagues about their challenges, trials, and triumphs that were experienced in order to succeed. We hope you will use it as a teaching tool for your students, employees, and for yourself. We want to thank Johnson & Johnson Vision for their generous sponsorship of our entire Eye on Diversity initiative. Thank you.
My name is Dr. Carissa Lee, and I am so proud to represent Johnson & Johnson Vision in support of ASCO's Voices of Diversity project. Diversity, equity, inclusion, and belonging are so important as we think about how, as healthcare practitioners, we strive to keep our patients at the center. ASCO's Voices of Diversity is one step towards celebration of diversity and towards a better understanding of why it must be always top of mind for healthcare practitioners to serve our diverse communities. At Johnson & Johnson Vision and through our AccuView products, we have made a commitment to support specific areas in the eye care industry that embrace and celebrate diversity, equity, and inclusion. We are committed to support and sponsor new programs to improve representation of people of color in optometry, to bring more diversity and equity into the eye care industry, and to create more culturally relevant information and eye health education materials. I applaud all of you who are on this lifelong journey of personal and professional growth with us and look forward to a future where there are more equitable eye care experiences and healthier outcomes for all. Thank you for taking the time to participate in these conversations in service of advancing a world that embraces and celebrates diversity of thought and background.
Hello, my name is Dr. Stephanie Johnson Brown, and I am a second-generation optometrist, and I am in Chicago, Illinois. I'm also the director of a non-for-profit called Plano Child Development Center, which works with the community, those in need who need the specialty that I love, which is vision therapy services, and also people who wouldn't get community service and vision health education awareness. So there's a need of service. As a result of that, and knowing what I wanted to do young, I kind of noticed that I was different, basically because of how people looked back at me and reacted to me. So as an optometrist of over 40 years, my optometry school class of 140 something, it was 14 women, and of those 14 women, it was 2 of us were black young women. So of course that experience was an eye-opener when I definitely had some of my classmates literally tell me that you took the place of one of their friends. And I'm like, okay, but I didn't let it get to me. You had to be resilient. So go on to that. Now, I told you I love this area of vision therapy, so I ended up having to do a lot of continuing education and different types of classes with OEP and COVD. And that even made me more of a minority, it felt, because you go into sessions like that, maybe 100 in the room, and I might be the only person that's black in the entire session. Most people just looked at me, but a very handful actually were drawn to me, and they became lifelong friends. No matter, they did not see the color, we were just friends. But more people made you feel isolated. Coming along through practice, I did join Doctors Alliance, the same thing. You go into the meetings and you're the only one. So I just think people don't realize that. And as an African American, you kind of learn to code switch, and you know how to not be yourself, but not let it control you, and to be resilient and just keep moving on. As a result of that, I've had several opportunities of leadership positions, not only in a predominantly underrepresented minority organization like the National Optometric Association, where I'm a past president, but also in my state association, where I have was the Optometrist of the Year. One experience that really brought all my associations together and let me see really the light past just being a minority was right after the George Floyd whole incident with the all of the uproar. We were one of the offices that definitely our office was vandalized. I had so many of my colleagues, my classmates, I didn't really even remember them all, to reach out to me. Saw no color, asked me, a couple of them said, what can I do? Help me understand. What is it that I don't see? Why are black people so mad? And I told them the first step was realizing there is a problem. And to be a diverse person, it just means that you're just being welcome into a big group. But also being equal, you're at the table at the top. Included, you're in the group. But if you can come to the top, as I kind of noticed with the AOA being selected as a delegate for my state, and also being selected as an advocate to go for advocacy for the AOA, you really are in a minority, but you just can't let it get under your skin. You have to make a great opportunity, and you have to remember your core is to serve. And I think I get more out of serving other people than just providing that service to them. So giving is a big part of what my core values have been, just growing up with an optometrist as a father and my mother as a teacher. So my biggest message is to be sensitive to what other people look like, whether they walk into your office, and don't judge them by how they look. You can't tell what's in their pocket. And just persevere. And that's my message.
Hello, I'm Dr. Clyde Oden. I am from Oakland, California. I have been in optometry since 1967 when I graduated from the University of California at Berkeley School of Optometry. I stayed an extra year in 1968. And in 1969, I got my master's in public health from UC Berkeley School of Public Health. The conversations are about the issues around diversity and my experiences with regard to that. When I graduated from the School of Optometry, I was only the fourth African American in its history to have graduated from the school. The other three, one graduated 3 years before me, the other 4 years before me, and the one before that 25 years before me. That was Dr. Marvin Poston. And so our experiences in terms of Berkeley was one in which African Americans in particular and Latinx also were very much a minority and very, in a sense, ignored by the university. It wasn't that anybody was standing at the door saying, no, you can't come in, but there was nobody at the door opening the door and asking and inviting persons from the communities that I represent, that optometry represents such a wonderful opportunity. So when I did finally get active in optometry, I went to the American Optometric Association, attended the meetings there, and found that it was not an inviting place. They were not used to seeing many African American practitioners because there weren't many, and because of the sort of Midwestern and Southern orientation of much of optometry, organized optometry, it was not an opening and welcoming place, which is why I had a chance to meet with Dr. C. Clay Powell and Dr. John Hollett and had discussions about starting the National Optometric Association, which would be an organization that addressed some of the issues of minority communities, particularly African Americans, in optometry. And so that's what we began in terms of our conversations, and that's how the NOA began back some 53 years ago. And so this evening I'm going to speak at our formal banquet about the journey that I've been on in terms of from the time of pre-NOA to the beginning of NOA to where we are now. And that's been a remarkable journey for the National Optometric Association. And there's still many challenges that they are facing, many challenges our nation is facing, and trying to be more inclusive, more diverse, having more equity in terms of the issues of vision health, particularly dealing with underserved communities. And that's where the major challenge is. And I'm going to challenge this evening those that are in the dinner to rise to those challenges and understand that progress does not come on the wheels of inevitability. That's quoting Martin Luther King. It requires struggle, it requires commitment, and it requires persons who really want to make a difference. And I believe those that are at this particular meeting want to make a difference, and I want to encourage them. Not only those who are currently practicing, but the wonderful students that we've met this week who are on their way, to those that are part of the various organizations supporting the NOA, as well as others that are called allies, friends, that there's much work to be done, and I want to encourage them to do that work so that we can make a difference in America.
My name is Dr. Vicki L. Hughes. I'm a graduate of UC Berkeley School of Optometry in 1978. I was the second black woman to graduate from that college. 39 years after Dr. Marvin Poston became the first black optometrist to graduate from the school. And as a matter of fact, he was one of the ones who encouraged me to consider optometry as a patient because I needed some eye exams, and I had met a couple of black students at Berkeley, optometry students who had recommended me to see him. And when I went to see him, I was surprised because I'd never seen a black optometrist, didn't even know there was a black optometrist before, especially since everyone in my family wore glasses. So when I went to see him and he found out I was studying physiology at Berkeley, he said, "Would you consider being an optometrist?" And I said, no, I hadn't thought about it, but I'll consider it. And I did apply maybe later that year when the time came, because I was already studying medical school or be a choreographer until I started taking classes in neuroanatomy, and to me, looking at all that gray matter looked boring. So, I mean, it's all gray. And then when I studied the eye, it's so pretty looking back there. Look at the redness, like my favorite color, orange. One thing about going to Berkeley, in my class there were out of maybe 64 students, there was 8 of us who were, 4 that were black, 4 that were Hispanic. The black students dropped out and one of the Hispanics dropped out. So in that class of graduate of 78, I started in 1974. And it was difficult because everybody had their own study group. Like all the Asians studied together, majority of the whites studied together. So it was pretty segregated. I do remember when I became an optometrist, or even before I graduated, I think one of the students told me that even though you made it to the second year of optometry school, you have 50% that you may graduate on time. So when I heard that, I was like, they watch me. That's pretty much what I said. Watch me.
My name is Keisha Sims Elder. My journey to optometry was not direct, but reflecting on my pathway, I think it was destined. Diversity, equity, inclusion, and belonging is very important to me. As a Black or African American female optometrist, I have consistently navigated spaces throughout my life where I have been one of few or the only person of color, female, and or optometrist. This began early in life when I was one of the few black students in advanced classes during my primary and secondary education. This trend continued throughout my time as an undergraduate student at Clemson University. There were not a lot of black students at Clemson in the late 80s, early 90s. And it certainly continued when I entered optometry school at the UAB School of Optometry in 1994, where I was one of very few black students at UABSO. My life experiences have made me acutely aware of the importance of having diverse, equitable, and inclusive spaces and the adverse effects when those spaces are absent. Being the only can be a very lonely place, and it takes a certain level of grit to keep pressing forward in a space of such loneliness. To be clear, my the only has usually been black, female, or optometrist, but your the only can be something visible on the outside or something only you can see on the inside. When you are in a place where you feel like you really belong, you can present as your authentic self, and your onlyness is not a hindrance. It is just a part of who you are. This is an environment where you can succeed. Diversity, equity, inclusion, and belonging brings innovation, creativity, and success. On September 1st, 2022, I made history. I became the first black or African American female to lead a school or college of optometry when I began my tenure as dean at the University of Missouri, St. Louis College of Optometry. I did not think that I would achieve this historic milestone because I assumed someone else would do it before me, before 2022. One of the most impactful outcomes of my appointment as dean is that it shows other people that they can do it also. I am Keisha Sims Elder. I am the first black or African American female dean of a school or college of optometry. I am why diversity, equity, inclusion, and belonging is important. I am what diversity, equity, inclusion, and belonging looks like.
Hello, my name is Dr. Jeanette Pepper. I work at Southern College of Optometry, where I'm an associate professor, and I'm the coordinator for student diversity and inclusion at the college. Diversity, equity, and inclusion are important, specifically in optometric education and in eye care in general. As far as experiences of students in their optometric journey, being aware of how inclusive your organization is or how welcoming your organization is it's a game changer, to be completely honest. Marginalized students usually have invisible barriers that may not be made aware of by others. So these barriers such as imposter syndrome, thinking, or barriers, especially if they're the first one in their family to go to college and they are, the whole family is depending on them, so they have everybody on their backs trying to succeed, that sort of thing. But the other things is, those subtle things such as microaggressions that say you're different, you may not belong here. Those are things that kind of work as, I guess, what they call little cuts on you, right? And they continually to push you back just slightly or affect your confidence and things of that nature as you're trying to go through your optometric career. I do remember instances in my optometric journey of feeling as if my professor didn't care if I was there or not. And so, and there were actually rumors that this professor didn't care for certain marginalized groups that I was a part of. So understanding that and knowing that the other psychological stressors that are there on top of the rigors of optometric education makes it harder for some students as they're going through their career. So making it a point to be welcoming, to train faculty and staff on the importance of making everyone feel as if they belong here, and that even if they have those invisible barriers, having someone there to talk to them, to be a confidant, to encourage them as they go through it, makes a world of difference in the outcomes for those particular students and things of that nature. So that's why I think diversity, equity, and inclusion is important for optometry.
Hi, my name is Melissa Contreras, and I'm an optometrist and faculty member at Marshall B. Ketchum University at the Southern California College of Optometry. I'm also the Assistant Vice President for Diversity, Equity, and Inclusion at Marshall B. Ketchum University. Why DEI is important to me, I will go back to my experiences as a child in healthcare, visiting with my family to the doctor's office. My family speaks Spanish. Some of my family is bilingual Spanish-English, and some of my family members just speak Spanish. And I always was there as a default kind of interpreter for the situation as a child. And I didn't know any different when I was little, and I was there and I was happy to help. It felt like I was, being included with the adults and able to interpret these sometimes pretty complex ideas and terms, especially for my grandmother. And coupled to the fact that I was a high myope growing up, and so circumstances led to me choosing optometry as my profession and my passion. But once I got to optometry school, I saw a different experience that patients had from different backgrounds. I saw how different it was when a patient spoke English as their primary language compared to patients who spoke Spanish, or my lived experience, seeing how difficult it was to navigate healthcare as a non-English speaking patient. And so I started to think about how patients' experiences are different and how I would want the care and comfort and sense of belonging that patients, in this case language-wise, that spoke English, I saw had compared to patients that didn't speak English. And I wanted that same sense of belonging to be for everybody, no matter, what language you spoke. And now, that I'm much farther along in the process in my journey, from every background, from no matter where you come from, I believe everybody, has the right to health and has the right to be able to see as clear as possible. And so I'm passionate about making sure that people's needs are met, that providers, that clinicians and optometrists, that they understand that it's important to consider their patient sitting in their chair, consider their experience, consider what they may have gone through prior to sitting in your chair, and what they will go through moving forward after you've given them recommendations. So it's not just about me saying, I prescribe this and I recommend this and please go home and do this. Can they do it? What are the barriers they are facing? Are they going to have the same health outcomes or potential for improving health that somebody that didn't have as many barriers or doesn't have as many barriers has? And for me, it started with language as my eye-opening experience, comparing my childhood and my family's experience in navigating the healthcare system and the challenges in accessing care and navigating that healthcare system, that now drives my passion for educating our community of professionals, our students, our future colleagues, and the public in general.
Hi, I'm Dr. Millicent Knight. I am currently Senior Vice President at Essilor-Luxottica, our Customer Development Group, and I'm a graduate of the Illinois College of Optometry. And I love talking about diversity, equity, and inclusion because it's such an important topic. I just recently completed my certification from Cornell University simply because I wanted to make sure that I was approaching this topic from a space of best practices so that I can help people get to where they need to be. So I will just briefly tell you what I think diversity, equity, and inclusion is. And the best example I have of that starts with something that a DEI activist, Verna Myers, mentioned, where she likened diversity, equity, and inclusion to diversity being invited to the party, inclusion being invited to dance, and then I would add to that equity is being asked to choose some of the music. So I think the area that people struggle with the most begins with inclusion because many people think that inclusion is subtractive. And it is actually additive. It's an opportunity for everyone to be involved. But equity is also an area where I think that there are some challenges, particularly with those who have been considered more in the more privileged category or the majority category. and having to feel that there's a possibility of giving up something in order for someone else to gain. And I think that that's really the area that we have to get really honest about, and we really have to dig in and do some work together so that everyone feels involved in the process. Share an experience that I think really brings home the importance of everyone being involved in diversity, equity, and inclusion, and also not making assumptions. When I was a high school student, I actually attended ICO as a patient. And my student intern at that time, I asked just tons of questions about optometry. I was really interested in it. I was interested in what he was doing with during the eye examination. And afterwards, he answered all of my questions, and then he took me to the admissions office and made sure I had all the information that I needed for references. And I remember thinking that at that time, probably neither he or I would have known that I had an opportunity to go on as an optometrist and examine over 100,000 patients in my career, as well as the work that I do in industry today. But I say that to say that this was a white male who made no judgment about whether or not I, as a black female, could be an optometrist also. And because of that, the majority of those 100,000 patients I've gone on to see have been Caucasian. And that's an opportunity for the many glaucoma cases, macular degeneration, strokes, hypertensive cases, diabetes, autoimmune diseases, all of those opportunities I've had to be able to help patients. I would not have gotten that opportunity had that individual prejudged me.
Hello, I'm Shawnell Jenkins, and I'm an optometrist at the Fayetteville VA in Fayetteville, North Carolina. I went to school at the Southern College of Optometry, and I'm a graduate from the 2018 class. I think the biggest takeaway I've taken from my experience at the VA so far, as diversity goes, is having the understanding of what your patients have experienced thus far in healthcare, especially patients of color, reflecting on how previously in the healthcare system, veterans, black veterans, especially in my case, may not have received the most equality in healthcare, and having to understand that we need to have better communication with these veterans. Perhaps we need to word things a little differently in order to gain trust from our patients. That way we can just have a conversation. It's a lot easier to have an honest conversation with someone about their health if we know more about how they view healthcare in general.
Hi everyone, my name is Bree McGee. I am from New Orleans, Louisiana. Proud Pacific graduate of College of Optometry in 2016. Being an optometrist gives me life because I can finally see myself. I remember when I first applied for optometry school, and when I attended optometry school, I was the only African American student in the entire school. And I remember I went to the current dean at the time and was a little apprehensive about everything, and also was thinking about leaving optometry school. It wasn't until I came to the National Optometric Association's convention in Toronto, Canada, where I started to feel like myself and that this was a profession that I belonged in. One, because there was a mosaic of people from different backgrounds, different cultures, different ethnicities, different racial gender groups, and I felt at home. It was like a family reunion. And when I went back to Pacific, I thrived beyond the roof. And I tell everyone that representation does matter. And in order for you to become your best self, to become a better student, to become a better doctor, you have to see yourself. And if you don't, you may not find your place in this profession. And since that time, I do applaud all of the organizations, ASCO, AOA, NOA, the Academy, for really striving to bring forth more awareness on EDI topics, on just embracing the idea of diversity and the beauty that it comes with. So thank you all so much, because again, being an optometrist gives me life because I see myself.
My name is Jarette Johnson. I'm a practicing optometrist of 32 years. I practice in New Orleans, Louisiana, and I graduated from Southern College of Optometry in Memphis. I am really so happy to talk about DEI, because I think I represent all of those things, being a person of color, being a woman, and also being in a profession that was always considered sort of non-traditional. For me, I graduated from Xavier University, a historically black university, and I was the first graduate of that school to ever become an optometrist. And that was very interesting because even at that time, the profession of optometry itself was not promoted to people of color. Basically, they were advocating for me to go to medical or dental school, but because of a HCOP program, which was a program set up by the government for minority students interested in health professions, I chose optometry. I had an opportunity to go to UAB School of Optometry for a summer program that introduced me to many mentors, many today who are leaders in the profession, namely Dr. Mel Shipp, who mentored me and encouraged me to become an optometrist. One of the things I think most for me, even at that time, 33 years ago, not only being a person of color, but being a woman, was a real challenge. Optometry was dominated by white males who not only were not sensitive to people of color, but specifically women. So I was one of very few women in the class of optometry. So again, entering school with both of those challenges really presented a case where there was a need to constantly prove myself over and over again. But I think that all of those things really created for me the impetus to even work harder, strive harder, and also to mentor other people to enter the profession. But looking at what happened to me in optometry school, SCO is located in the center of Memphis. Many of our patients were African American, lower income patients who were being examined by mostly white males who really could not relate to many of their backgrounds, their situations, understanding that you had to do more in the eye exam. You had to be a little bit of a social worker. You had to understand the vernacular. You had to kind of understand why maybe they came in and they had such severe glaucoma, because it was really about survival. And I think that teaching people more about the social ills of life outside of an eye exam can help people understand more why people do not seek treatment. It was so profound to me that when I left optometry school, I entered Tulane School of Public Health to understand more about health disparities and at-risk and marginalized populations. And that in itself gave me greater skills to be able to really help the population of patients that I was going to serve. Because soon after I finished the School of Public Health, I worked at a community health center. And working at that community health center really magnified why it is important to have people of color serving these at-risk populations, because there was a huge distrust from the majority population, particularly with African American men, about treatment modalities. They were distrusting. They remembered a lot of the Tuskegee experiment studies. So they didn't believe. So if they could see someone who looked like them, who cared about them, who they felt like really understood them, then they were more likely to accept treatment and help. So I think that the idea of creating more students, more diverse students in optometry school, creating more faculty and staff that can understand people of different backgrounds to be able to help teach students will improve the profession of optometry overall. And I think when I look back at my 33 years of practice and realize that even today we still only have 2% or less of practicing ODs that are African American, I think that it really speaks to the fact that we need to really work on diversity. Thank you.
Hi, my name is Dr. Dana Shannon, and I'm originally from Chicago, Illinois. I attended optometry school at the UAB School of Optometry, and I finished my residency at the University of Chicago, so now I'm back in Chicago, and I'll be working at a private practice going forward. So I wanted to share some of my experience with DEI and why it was important to me and how it affected my decision to attend which optometry school I decided to attend. So I am from Chicago, and the question that I often get is, why didn't I go to the Illinois College of Optometry? My reason is because when I decided to interview, I interviewed at ICO first. That was somewhere I always wanted to go. I remember that I worked at a hospital in Milwaukee, Wisconsin, where there were some ICO alumni that worked there. And I remember speaking with them and asking them, do you think I will get into this school? Do you think that my prerequisites and my GPA and my OAT score would be enough for me to make it in? And I remember that alumni telling me that my OAT score was not high enough and that I should repeat the OAT. At this time, the alumni, she had been working at a separate practice. She had graduated a long time ago. And so at this time, I went ahead and purchased the OAT. I went ahead and bought the OAT test again, and then I interviewed at UAB. I went to UAB. It was a cold fall day, but when I got there, I was welcomed by a lot of warm smiles. And one thing I noticed was that a lot of the faculty there were African American. That was really impactful for me because I, at the time, was not aware of that until I actually interviewed in person, and I saw there were so many faculty, staff, people involved in the admission process that were of color. And when I walked down the halls, I saw other students of color that were there, and they welcomed me. And that made a big difference in my decision. And so I decided not to retake the OAT. I actually got accepted to UAB. And it wasn't because, my OAT was fine. I was told that my OAT score was fine. My GPA also was already really good, and I had all these other experiences, and I interviewed well also. But I just felt that my initial experience being discouraged from someone who was an ICO alumni, someone not of color, and then my interview at ICO, I just felt like I was kind of shuffled into the group, and I didn't see other people that looked like me there. And when I went to UAB, it was a complete 180, and that was a big part of why I decided to go where I went. I decided to travel across the country to the South and not stay at home, and that was a big difference for me.
Hi everyone, my name is Priscilla Chang. I am an optometrist in California. Born and raised in Oakland, went to Illinois College of Optometry and did my residency training in Atlanta, Georgia, and I am now working with Johnson & Johnson in the LA area to help launch their new Ortho K lens. But one thing that I did want to share on this topic of diversity, inclusion, and equity is being able to practice radical empathy. And one of the activities I've done in my training is an activity where they collected a group of people from diverse backgrounds, and we actually had to share stories about when we felt like we weren't being heard, or when we felt like we were being attacked, or just stories where we didn't feel safe. And how do we change those kind of environments without first sharing the kind of experiences that we've had so we don't replicate that. And so an activity that we did was actually in small groups, and what we did was we actually talked to each other and we shared the stories with one or two other individuals, and the activity involved them truly understanding that experience. So they were allowed, I think the first person, I was allowed to speak uninterrupted for 2 to 3 minutes, and then afterwards, the people who were listening to me could ask follow-up questions. And they could really, really try to deepen their understanding of that experience. And then from there, after everyone got to do that in their separate groups, we actually came together, and the people who were listening had to be the one to give a first-person account of that same experience. And I just remember how powerful it was to have people share stories of, being raped, being assaulted, experiencing gun violence, growing up with, a lower socioeconomic background. Of this activity was that since we come from all walks of life, we do not truly know what it's like to be in someone else's shoe unless we put ourselves in that situation and truly try to imagine what was the experience like. And we don't do this enough because I feel like in general, we're all very me-centered culture. Like, what is it like for me? Why am I not being heard? But really, when we're thinking about diversity and inclusion and equity, is how do we think about, like, okay, now I'm in this room, but like, who's not here? Like, what barriers are they experiencing, and trying to understand that, and then like, how can you bring them into the room and let them be their authentic self, and really kind of have their voices heard, and being able to impact how an organization runs and those kind of things. But in this activity, I'm listening to stories about, firsthand experiences of rape, assault, prejudice, racism, or, language barriers that they're trying to work through, and like feeling like they weren't heard, those kind of things. And I just think as healthcare providers, we really need to spend our time really understanding our patients. And I think as our industry is so focused on, let's get these patients through faster and faster and faster, or let's try to fit more things into our curriculum, really we need to pause and really try to understand, like, who are these people who are coming into our clinic? Who are the people providing this care? In our training, do we have any biases or any kind of cultural competency that we can relay to our students, so they can be better providers and truly understand that aspect? And that would just make us all better, right? It would build for a better world where we're more inclusive of each other, and everyone has equal opportunity.
Hey y'all, my name is Dr. Tiffany Humes. I am an optometrist. I practice in Detroit, Michigan. I practice in a hospital setting. I'm a graduate of Pennsylvania College of Optometry. Y'all now call it Salus University. I want to talk about today something that I noted when I was a student, specifically in first and second year, just when we were kind of starting getting into clinic. And what I noticed, and it was something that came from my colleagues around me who probably didn't even realize they were doing it. When we first started to look at the eye proper, especially when we got to retina, I would notice that I would kind of get passed over by my colleagues to work with, to look at the retina as well as to look at the iris. And I realized it was one, because my irises take longer to dilate than other people because they're brown. And then I also realized that my retina was darker than many of the other people in my class, also because I'm a black person. And at first that really bothered me when I first realized that. But then I came to the conclusion that my colleagues were the ones who were missing out. Because the whole point of diversity and what we're doing here is that you're not just going to see retinas of people who look like you. And so when you get out into the greater world, you're going to see retinas of people from all entire walks of life. You're going to see irises that range from very, very light blue to very, very dark brown. And you're going to be able to need to make diagnosis and assessment and a plan regardless of that person's color tone. And so I hate that my colleagues missed out at that time, but I would certainly hope that moving forward, we would try to be more fair and be more just in the way that we train our students, so that no student ever feels the way that I did, which was disadvantaged, but also that every student receives the opportunity to get diversity.
Hello, my name is Dr. Jacqueline Davis. I graduated from Ohio State University, the Ohio State University, back in 1981. So I have been around a long time. And the question about what does an inclusive future look like, I would love to see underserved populations receiving quality vision care from doctors who understand the implications of implicit bias and lack of health literacy and socioeconomic impacts on communities. And I think the only way that we're going to have doctors who know about these things is if they are getting that in their optometric education. And so I think it's extremely important that we provide that to our students and that we give them all the tools that they're going to need in order to be able to serve underserved populations in a willing and joyful way. And therefore, I hope that being involved in education, in optometric education, is going to continue to work with outreach and allow us to provide providers who love communities and who love providing vision care for all people.
Hi, I'm Cynthia Hurd. I am a graduate of Ohio State College of Optometry, 1992. Since that time, I've completed a residency at the Birmingham VA Medical Center, where I actually trained to manage veterans who were visually impaired or blind. I also worked with veterans who were geriatric age, and of course, those where eye disease was a concern. So since that time, I've actually worked in clinical teaching my entire career. I spent 14 years at the Ohio State College of Optometry. And then I have since then been at Southern College of Optometry in Memphis, Tennessee since 2007. And now another 15 years in working with patients and with students. One thing that I think is a really important group of individuals to discuss, at least for this talk, is individuals who are visually impaired, whether they be legally blind, totally blind, however you define blindness. I find that it's created a passion in me to be a really big advocate, or even more of an advocate, for these individuals. Now, as we look at ways in which people are different, we always have to think about intersectionality, where because an individual may be African American or female, like myself, we also have individuals who are visually impaired, and they might also have other issues going on top of that. So every way in which an individual is different is what contributes to their identity. Now, when I'm working with my patients, my low vision patients, I am particularly cued into what needs they have. So of course we ask them, what brings you here today? What can we do for you that you cannot do or accomplish? So our goals are a little different than for a typical patient. I am particularly also honed into young individuals who are visually impaired, who may be a part of the school system. Now, because of the Americans with Disabilities Act, we know that these individuals have rights to certain things, certain accommodations, known as reasonable accommodations. So one thing I make sure and do when I examine these kids, I talk to their parents about what they know. So I tell them that they need to make sure that we can communicate with their schools to find out what services or even products that they need to have in the school setting so that they can function better. Because the goal there is to make sure that their learning experience or educational experience is maximized as much as possible. So the best way to do that in most of these cases is to make sure that the children have devices that they can use so that they can see what they need to see. So we work with different agencies. There's one agency in particular that I really like to give notice about, and it's called Sight Savers of America. This organization has come alongside Southern College of Optometry, the low vision program, and they actually help us identify children in our communities that are visually impaired. Then they actually schedule or have the parents schedule these children in our low vision clinic. When we do that, we show them devices, mostly electronic video magnifiers, that we want to see how they interact with them more than anything. And if the child appears to be a good candidate for this device, then there's usually a way made so that the family can get this device or this technology that either may not cost anything for them, or it may have a small fee attached. And that way the child gets to maximize their vision in a setting where they need the accommodations that are promised to them through, of course, the ADA, so that they can function better. Now, another group that I'd like to speak about, again, we're talking about individuals who are visually impaired or blind, is individuals who are of the age where they complete high school. And then they may want to pursue college. They may also want to pursue technical programs, just like any other individual. I have the good fortune of being able to work with young individuals who actually have good enough vision, along with prescription of a telescope where they can drive. And they can do pretty much anything their peers can do, which is so exciting. I love it when our students get to work with these young individuals because they see low vision in a whole different light in that situation. Now, the one other thing that I try and make sure and do with these individuals is once they identify which college or program that they're interested in, there is typically someone at that university facility who their job is to make sure that reasonable accommodations can be made for that individual. So most of the time we talk about their vision in such a way that the person understands, what level of vision that they have in comparison to the typical type of vision people have. We also talk about the fact that they need accommodations like note-taking services, as well as longer periods of time to take their exams. They may need video monitors that can increase the size of font, or they need to be able to use a device like an electronic video magnifier to increase the size of the print when they are taking the test. They also may need to be in a quiet place where they can have the amount of time that they need, as well as be able to concentrate so that they can take the exam. That sometimes, some of us who don't have these issues will take for granted, and we'll think that, okay, well, maybe they don't need this, that, or the other. But I try and make sure that the patient or the person understands that before they go to college, and I communicate with the college in whatever form that they have me do, so that we can get them signed up with those services and they can take advantage of them as soon as they start.
Hi, I am Dr. Ruth Shogay. I currently am an associate clinical professor at the University of California, Berkeley, Herbert Wertheim School of Optometry and Vision Science, and I am a graduate of the Pennsylvania College of Optometry. And when I think about what an inclusive future looks like, that gets me excited and gets me to do the work that I continue to do and I enjoy doing. I am also Director of Diversity, Equity, Inclusion, and Belonging at Berkeley, and so an inclusive future looks like a place where not only are my students in an environment where they are happy to be, they feel like they belong, they feel like they're heard, and they're all getting the same kind of education that's going to make them inclusive practitioners. Because at the end of the day, all of this work that we're doing is important, is because we're taking care of people on the other side of it. And so I want to make sure that we are putting out future doctors who are going to be culturally sound and responsive and caring and competent, of course, to be able to continue taking care of our diverse population in the U.S. And doing it with humility, doing it with grace, doing it with understanding, so that their patients feel included in their care, in their practice, in their community, and will thrive because of that care that we're providing. So that's what I think about when I think of an inclusive future, and honestly, the future looks bright.
I'm Bondali Delgado Nixon. My pronouns are she and her. I'm originally from Santa Fe, New Mexico, and I identify as Hispanic or Chicana. I'm also Tewa and the Pan Apache. I am a professor at Ohio State, the Ohio State University College of Optometry. I teach pathophysiology to all the first-year students, as well as microbiology and biochemistry. So it's the basic sciences is my jam. And then I also am the Chief Diversity Officer of the college. Some of the things that I notice in students that I also experienced is that this idea of having obstacles in your way of your passion. So I think that one of the things that I recommend is to always remember what your passion is and think about what that will mean for your future. So if your passion is to provide care or your passion is to help others in need, think about that and really hold that in your mind. Think about what that means to you. See yourself in that future, because that will help you power through all the obstacles. There will be obstacles in your way, and it's okay to think about what those obstacles might be. Maybe it's a grade, maybe it's a board, maybe it's a challenging interaction with a patient, maybe it's not knowing what's wrong with a patient. I think you should have that expectation that that will happen, and then consider ways that you might overcome those obstacles. I know for my part, I didn't think that I would have any obstacles. I was pretty sure that I was going to be able to power through everything, and there were definitely obstacles in my way. There were obstacles related to my gender, folks that didn't think that I was maybe as educated as I was, or thought that I wasn't capable, and then came around to thinking I was capable if I got a fellowship or something like that. Or if I demonstrated my ability in some sort of public discourse. And that was pretty frustrating for me. So I think, again, you can get disheartened, but make sure that you move through that and have some self-assurance, again, keeping your passion in your mind. I also think it's really important to understand that you're going to be treated a little differently sometimes, or individuals might be treated differently based on their ethnicity or their perceived social identity, whether or not they speak English very well. Being from New Mexico, a lot of times people say that my English is really great, and that's because they don't realize that New Mexico is actually a state. So, again, it's remember that also sometimes people are ignorant and not menace. They don't have menace in their mind. So give grace to them, give grace to yourself. Again, consider your passion and keep moving through.
Hi there. I am Dr. Edward Lawrence Jones. They call me Larry. I am the president of the National Optometric Association. So my story that I'm deciding to kind of think about is when I was in optometry school and funds started kind of depleting. I think something happened when I actually filled out my papers for my loan, and I didn't dot an I or cross a T correctly, so it was 6 months out until my next loan or money came in. So I had paid for rent, I paid for my tuition and all my my lens equipment, my books and everything, but food was not there. So it was 3 months, I think, I went without eating, which was, one of those things where you kind of, was interesting. We actually, thank God, we had an apple tree in the backyard, and my grades were dropping because I just hadn't eaten for a long time, and people were saying that I looked nice and svelte and like thin and nice, but that was kind of nice. I was kind of shaking all the time, a little bit. It was, it was hard to concentrate. So one of my advisors actually brought me in, and because of my grades were dropping, and being a person of color at a university where I was like one of the only ones, it was a little bit more difficult. There was one professor that basically was questioning whether I should be there or not, and with that, one of the advisors brought me and sat me down and said, "Look, your grades are getting to this point. We need to do something." And so, she asked me if anything's wrong. I said no. So I basically ended up just kind of going on until I got a part-time job. But she said, "This is what I want you to do. I want you to go to this teacher once a week. I want you to ask him like some questions, let's say out of the lecture, some intelligent questions. And then I want you to, basically come out and ask them if there's anything on the test, any additional reading, things like that coming up on the midterms, because I think we had like 42 tests that quarter or whatever it was. So we have a test every week basically in optometry school, and everyone knows that. It's like, it's just a barrage. And so everything was kind of dropping, and so she was trying to catch me, and she did. And so I did that, and I think it was physiological optics, and I got a B in that class because he started to get to know me. I think that was the whole thing, is there was that little bit of fear, that little bit of whatever it was, and that little bit of not thinking that I had it to make through. Now I'm actually the president of the National Optometric Association. I'm mentoring people all over the United States. I'm thankful that I was able to have this advisor step in and tell me that this is what you need to do, and she gave it to me, and we basically went through those things. So I'm so thankful. And now again, we're helping advance the visual health of minority populations, and just enjoying being part of a much larger machine, working with the American Optometric Association, working with ASCO, which is doing a great job recruiting and helping get young people of color to become optometrists, which I'm so proud to be a part of this. And so I'm thankful that we're doing this, and I've been looking forward to seeing how many people we can get together and create a better family. We think of ourselves every year as a family. So if you're ever hear about an NOA convention, you're invited. Please come, and we look forward to meeting you in the future.
Hey, how y'all doing? My name is Jacory Clayton. I'm a first-year student at the Kentucky College of Optometry, and one question that was asked was, why did I choose optometry as my career field? One of the main reasons I picked it was there's not a lot of black males in optometry, only like 3%. And I want to be one of the people who help changes that down in the future. And the way I got down this path was I went to see my family optometrist, Dr. Handy, and after we spoke to him about a particular case, this one older lady in her husband had a severe case of cataracts, and I talked to him about it, and I kind of grew an interest from there. It led from that to shadowing to community service, and community service to working for him for like 2 years. And I was like, yeah, I can see myself doing this for like 40 years. So I feel like one thing that stops or hinders more black people getting into optometry is there's not a lot of representation, or there's not a lot of representations in schools. You don't really hear about it from your friends or your family who may be doctors, or just people in general. It's not really thought about as much. Because I certainly wasn't thinking about it when I was going down the sports medicine route. But I think one way that we can change that is, obviously, we promote ourselves more. Like, bring more attention to organizations like the NOA or the AOA, or maybe have them have like a chapter at schools, like maybe HBCUs or PWIs or what have you. I feel like the more exposure we get and the more we, I guess, talk about the benefits of optometry to other students, like in the medical field or just in general, there will be more people who will be more willing to, not willing, but would be more likely to come do it. Because if you would have told me that I could still be a doctor and have a life, I would have went down this route before I even thought about sports medicine.
Hi, my name is Dr. Cheryl Reynolds, and I am an associate professor at Nova Southeastern University College of Optometry. I just want to share briefly my journey to becoming an optometrist. So I am a child of immigrant. My parents came here from Jamaica. I did not know anything about the profession of optometry. I went to University of Florida thinking I was going to be a pediatrician. It didn't work out, but I also had some challenges. I had professors and advisors say you people couldn't or shouldn't or wouldn't, and I think those negative voices in my head sort of, kind of swayed me a little bit, but I had an awesome, amazing mother that believed in me. So as long as someone believes in you and someone says that you can do it, just keep going. The other thing is I did apply for optometry. I took the OAT exam, and I applied for Nova Southeastern University. At the time, it wasn't Nova, it was Southeastern, and I got in. And even then, I had a lot of challenges, and one thing that I would definitely advocate is mentorship. I had an awesome, amazing mentor. He passed away, the late Dr. Terrence Ingraham. He was the president of the National Optometric Association at the time, and that's why I'm involved in the National Optometric Association, who's been dedicated for over 50 years in moving diversity, inclusion, and equity in the profession of optometry. And I continue to stand on those legacies and those mentorship thoughts and inspiration. The late Dr. C. Clayton Powell, the late Dr. John Howlett that started this organization, they inspired me. So I want to say to the young students, we all stand on the shoulders of giants that have come before us, and it's important to recognize that, but also important to know that mentorship is so important. If you're thinking about the profession of optometry, speak to someone, your eye doctor, your pediatrician about the eyes, and if you need more information about optometry, please follow up, do your research, and you can always contact me. I am Dr. Reynolds, and I will definitely be a mentor to you. I will definitely guide you and make sure that you understand this profession, because lastly, I just want to let you know, this profession is more than just giving glasses. We save sight, okay, but we also save lives. That's why this profession means so much to me, and that's why it's important to make sure that we have a very diverse profession to serve the patients that need our help.
Hello, I am Dr. Camille Cohen. I am a Pearl Vision franchise owner and practitioner. I graduated in 2014 from PCO at Salus University, and I think that for me as a past student, something that always stood out for me as a first-year student, I recall the requirement to go to clinic and have an eye exam and get acquainted with the Eye Institute, and I had an upperclassman who did my exam, and the entire exam, he never once looked at me. He looked down at his paperwork and kind of scoffed at me a few times and kind of talked at me when I was trying to explain to him, my family history and, my past medical history, and I basically implied that I was a student there, but he didn't pick up on any of that, more so almost berated me for not having had a diabetic exam when I had or simply because I had a family history of diabetes, not taking into account my age or the fact that most of my family had type 2 and I at the time was in my early 20s. It felt very cold, and it wasn't until a preceptor came in and welcomed me to the school because I had on a lanyard like this, but with the school's name, that she recognized that I was a student there. And that was the first time he actually looked up at me and saw me. So it gave me an insight to how possibly patients were being treated at the clinic. It gave me insight into how I might be seen as an other, as a student, and it really alerted me to some of the possible microaggressions experienced by others. And I can say for me, while I had an amazing time at my school, there's always room for improvement with staff, with the student body, just collectively to make sure that nobody has to ever feel like an other.
My name is Dr. Shaka Norwood. I am an optometrist, and I graduated from the University of Houston in 2010. I chose optometry as a career because I was introduced to it when I was a high school student. My optometrist, he was a white male, but he introduced the career to me, and when I went to school, I delved into it, and I was like, well, I can't see. Let me help other people see. So when I got into my career, I always got the same response from my patients. I've never had a black optometrist, or I've never had a female optometrist. So I decided, I needed to be an advocate for black African American students to become optometrists in this profession, because we needed more people that looked like us. To students at schools of optometry, I speak to high school students. I also perform eye exams in the school system where I grew up in Mound Bayou, Mississippi. So I get a lot of responses like, well, you're from here, you're from Mound Bayou, so you're an optometrist, and I can be an optometrist as well. So I like to be an extension so that I can introduce this profession to African American students.
Hi everyone, my name is Dr. Faiz Mahjoub, and I'm a 2018 grad from Western University College of Optometry. I wanted to share a little bit about some pleasant surprises that I've had in my path in optometry so far. So the first being that discovering optometry itself was a pleasant surprise for me because I wasn't actually familiar with the profession until I met my undergraduate counselor who was trying to get me to go on a career path and to start kind of preparing for grad school. I was interested in science, but I didn't really necessarily want to be in a hospital setting, and when she told me about optometry and I met the local optometrist who came to visit our pre-optometry club, that really changed my perspective on what my career could look like, and it really felt like the ideal fit for me. So that was definitely a pleasant surprise. And I'd say the second pleasant surprise was once I was actually in optometry school, learning about the various organizations in the profession, and particularly the National Optometric Association, which I got a chance to visit their national convention after my first year of optometry school. And for me that was a surprise because I didn't know that there was this group of people who were really passionate about helping students thrive and find their way in the profession. And the support and mentorship that I've gotten from the NOA over the years has really made the biggest difference in my career and my life as well. And the third surprise I would say kind of came after I graduated from optometry school, which is discovering entrepreneurship opportunities that are outside of patient care but still serving patients. And so part of that actually stemmed from a support that I got from one of my professors in optometry school to explore entrepreneurship and learn about technology, and that stuck with me after I went through my fourth year rotations and got to do more patient care, and I discovered that patients really struggled with inserting scleral contacts. And after I graduated, I started learning more about technology and 3D printing, and that drove me to start a startup called Augmented Vision Labs that focuses on helping patients insert their contact lenses. And over time, I kind of grew that to where now it's my full-time position to actually focus on that and help the patients who struggle with that. So that's the third pleasant surprise, and I'm sure there's more to come, but I feel very fortunate to have found optometry.
Hello, my name is Jennifer Trong, and I'm currently a second year at SCCO, and I just wanted to share how I got into optometry. So at first, when I entered into undergrad, I didn't really know what I wanted to do. I came into undergrad as a political science major, and when I was taking some of the classes, I thought they were interesting, but they didn't have a fulfilling feel to it. So then that's when I decided to take an elective called Compassion for Healthcare at my university. But interestingly there, it wasn't because an optometrist visited. It was because I asked a classmate, oh, what are you going to do in the future? And she said, optometry. And that kind of surprised me because I never really thought of optometry as a career before. So when she said that, I decided to shadow an optometrist that following summer. And that was a really life-changing experience for me, because that's when I decided that I wanted to go into optometry as a possible career for myself. Because when I saw the optometrist, just being able to recognize all her patients and having a good interaction with them, and the patients actually smiling back and leaving with a good experience themselves with their vision and their care, I was really happy to learn that there was such a career in this world, and that I wanted to be able to do the same for other patients.
Hi, I'm Ria Desai, and I am a third-year optometry student at MBKU. My experience with optometry so far has been really awesome. I, however, did not know I always wanted to be in optometry. I entered undergrad thinking I was going to go to med school, and that's just what people did when they wanted to go into healthcare. Through more experiences in undergrad, working with underprivileged young students and children in preschool and kindergarten, and just being part of a team that provided optometry services to them and glasses to them, kids who would have never realized that glasses would make such a big difference to them, and their education was really valuable. And then going from that to just my undergrad campus, when I did go out to seek resources as I was applying for optometry school, optometry really wasn't up there for the counseling services, and I feel like I did have to reach out to people outside of my school in order to learn more. Going to Opto Camp at Berkeley was definitely a really great experience to get more exposure into the field, and just really networking with people in optometry school and just doctors out in the field were very valuable experiences that led me to where I am now.
Hi, my name is Dr. Carol Merritt, and I'm a 1989 graduate of the University of Missouri St. Louis School of Optometry. I am so excited that I can share a little bit about my history and then let you know how important optometry is, especially in minority populations. I am a past president of the National Optometric Association, and during my time as president, I felt a real burden that there were so many optometry schools that were very underrepresented with minorities. And so during my presidency, I visited most of the optometry schools in the country, and I met with deans and I met with students and the NOSA chapters there, and I let them know that if I could do it, you can do it too. And I put a little pressure on the deans to let's increase minority representation in the schools. Our communities are very, we have very low representation. I practice now privately in St. Louis, Missouri, in a suburb of St. Louis, and I am booked almost 2 months out because there are just not enough practitioners that are doing private eye care in the minority population. I have a very heavy disease population, and that I see a lot of glaucoma and a lot of diseases that affect us in the population. Diabetes, I would say that every day I probably see 5 to 7 diabetic patients a day. And so we are just needed minority optometrists and optometrists that are interested in practicing in underrepresented areas. And there are so many areas in major cities that need optometrists. And so I am excited as a part of my life history is that my husband and I co-pastor a church in St. Louis for a little over 30 years. And so I always say that my gift is to help people see both spiritually and physically. And so eye care is so important. I'm also a former faculty member of the University of Missouri St. Louis, and I worked there for about 8.5 years specializing in ocular disease. And I really feel that we need to see more professors and more doctors so that we can see ourselves, because I didn't have that when I was in school, and it was so important that I became that mentor for so many students so that we can show that not only are we can be good and great optometrists, but we can also help the next generation. I'm proud that I have my 8-year-old granddaughter here with me at the National Optometric Association Convention who wants to be an optometrist, and I am so excited that Rachel has joined us and that we can together show the next generation that we can take care of eyes, because nothing is more important than your eyesight, and we are advancing the visual health of minority populations. Thank you.
Hi, my name is Chizoba Heather Ogoke. I'm a current OD in New York City. I just finished my residency at SUNY Optometry for vision therapy, and I'm a recent class of 2021 graduate from Arizona College of Optometry. I had a great experience at that optometry school. It is fairly new. But the one thing I can take away, and I let everybody know that I was actually not just the only black woman, but the only black person for almost 2 years. And not just my year, but all 4 years of optometry school. Fortunately for me, I did grow up in diversity. I went to West Orange High School in New Jersey. It was a very diverse town, so I've seen every color of the rainbow there. And also when I went to undergrad at SUNY Albany, I actually found myself being one of the only black people in my biology courses. So I started actually kind of getting used to being the only person of color as I increased my level of education. And unfortunately, that is just the reality we have, but we need to increase that. You know, clearly that is our goal, to increase the diversity in the medical profession that we have. So being the only black person at Arizona College of Optometry for almost 2 years, I felt like I went in there like I had something to prove, but I was just so welcomed by my classmates. I participated in a lot of leadership positions, and I just felt very welcomed. And just talking to all my classmates coming from different areas of the world and of the country, they were coming from the Midwest, California. I got to share my experiences, like growing up in an a Nigerian family. Education was number one. I always had to get good grades. That was my top priority. And I feel like I was actually their very first black friend. They didn't really even know how to refer, like, should I say black, should I say African American? These are conversations that we had through optometry school, and I got to see how they practice in the Midwest versus like how I practice on the East Coast. So yeah, I feel like my experience has been very positive, and I'm really happy about that because I got to share the diversity in my optometry school, and they can take that and go on to wherever they practice in America.
I grew up in a family of Chinese-speaking parents and grandparents, and when they first immigrated here, they didn't speak a word of English, and to this day, they speak very broken English. And when I think about my childhood, a lot of it was spent in these medical rooms that are, very, sterile and just, not friendly. But what ends up happening is, we have all these providers that do come in and they share their findings or their diagnoses, their treatment plan, which granted, they're probably great doctors, but I'm sitting in this room with my grandparents and like they're nodding and they're pretending like they understand everything, but ultimately they're turning to me, who's 10 years old or something, trying to explain the same concept that these doctors are trying to relay. And I think, I just, just from that standpoint, there's a lot of lost information when we're trying to communicate with people who have not only the language barrier, the cultural barrier, but doesn't have health literacy. And so I just think that as doctors, we can be better doctors if we are able to be a little bit more patient or speak in a way that is culturally relevant to that provider, whether it's making culturally appropriate for that patient if we are making, say, treatment recommendations or, providing them with the resources in a second language or connecting them with an interpreter. There's many ways to get around it, but really just not allowing these patients to walk out of your office without truly understanding whether or not they understand it. So, one thing that I do in practice is I like asking my patients, to reiterate, to repeat, what did I tell you? Did you understand it? Because in those situations where, as a kid that, you ask a family member to bring their own interpreter or whatnot, and maybe they may not truly be relaying the message of what you're trying to say, and then, these patients get subpar care purely because they couldn't understand you as a provider. So just being more empathetic to those families that do come in and do not speak English as their first language. They're experiencing a lot of stuff at home too, for example, because I was the only English-speaking person in the family, I'm here interpreting, all the paperwork that comes through, and I'm still trying to learn English. I don't even have mastery of that, and now I have to have mastery of Chinese to relay that back to, my family, and it's just so much on our shoulders when we walk into that office and say hi to you or come in with a complaint, because it took a lot of courage to, even come in and try to access that care.
Hi, I'm Dr. Essence Johnson, an HBCU-made residency-trained community and correctional health optometrist in the Dallas-Fort Worth Metroplex. And when I think of when I started in community health over 8 years ago, and my motivation from switching from a more kind of traditional private or corporate practice into going into community health was the need. I think back to growing up, and I remember my grandmother going into the hospital and not coming out alive. She was diagnosed with diabetic ketoacidosis, which is an accumulation of acid in the blood that is fatal. And it's all because we did not know that she had diabetes. She was only 53 years old. Fast forward a couple of years, and then my mother, she fell sick while I was on my way pursuing my education in college. And I remember her going back and forth to the hospital and not getting a lot of relief, not getting any solution to her pain. And as I was progressing through my courses, I remember telling her one day, like, hey, maybe you should ask the doctor to screen for cancer. And sure enough, the ulcers, the bleeding, it was due to having cancerous tumors in her stomach. She passed away at 46. Fast forward, and I think of my two sisters, and we're all in our 30s, and I look at the different kind of struggles that they had with either maternity or infertility. And I remember my niece being born, and I was actually on the way to one of the optometry conferences, and I remember getting the beautiful picture of my niece being born. But the weeks after, those postpartum weeks, my sister, she was complaining of pain. She was telling me that something wasn't right. I was encouraging her to go back to her doctor. And the doctor still was like, no, nothing is wrong. The nurses were like, nothing is wrong. Until one day, she kind of examined herself and realized that after her birth, there was gauze left inside of her. When I think of my own family, when I think of our level of education, the ability that we are financially stable, that we are insured, and yet there are still disparities in healthcare that have poor outcomes and could eventually cost us our lives, it definitely puts me in a place where I want to do more in my profession. I want to do more as a doctor of optometry. Community health allows me to do that more. Every day, Monday through Friday, lunes a viernes, I get the pleasure to be someone's first, la primera, a black female optometrist where the majority of my patients, they are black or Hispanic. I am fortunate to live in the same community that they live into. And every day I go to my clinic on the southeast side of Dallas, and I help provide superior care to my patients, not only in educating them about the conditions that I'm diagnosing them with, taking the time to also educate them in not only my language, but in their language, a language that they can understand. It never gets old when a patient tells me that, wow, thank you. Thank you for being my first minority doctor, my first black doctor, but thank you also for being the first doctor to actually take the time to listen to me and to educate. Now, it is not anything unique or special that me being a black doctor who are treating, other black and brown patients has that ability to communicate. That's something that each and every one of us, regardless of our ethnicity or our gender or any other cultural background, should be able to do. It doesn't matter where we are practicing. We should be able to provide superior care to all. Statistics show that black or Hispanic or minority doctors are more likely to practice in rural areas and to accept patients that are on Medicaid. And about half of black or Hispanic patients are on Medicaid. It's important that we are cognizant of where we practice, how we practice, and who we provide care to ensure that patients in all communities from all walks of life, they're able to have superior care. Especially in a community health setting, it is not uncommon for people to think that they are coming there and they're getting the leftovers, that they're not getting the best of the best. So that is why I, as a residency trained doctor, have chosen to intentionally give back to my community in the best way that I know how, and that's in checking eyes and saving lives, one person at a time.
Always remember what your passion is and think about what that will mean for your future. So if your passion is to provide care or your passion is to help others in need, think about that and really hold that in your mind. Think about what that means to you. See yourself in
We
that.
come from all walks of life. We do not truly know what it's like to be in someone else's shoe unless we put ourselves in that situation and truly try to imagine what was the experience like.
Profession is more than just giving glasses. We save sight, okay, but we also save lives. That's why this profession means so much to me, and that's why it's important to make sure that we have a very diverse profession to serve the patients that need our help.
So my biggest message is to be sensitive to what other people look like, whether they walk into your office, and don't judge them by how they look. You can't tell what's in their pocket, and just persevere, and that's my message.
Every day, Monday through Friday, lunes a viernes, I get the pleasure to be someone's first.
You would have told me that I could still be a doctor and have a life. I would have went down this route before I even thought about sports medicine. But
Being an optometrist gives me life because I see myself.
And honestly, the future looks bright.
I am Keisha Sims Elder. I am the first Black or African American female dean of a school or college of optometry. I am why diversity, equity, inclusion, and belonging is important. I am what diversity, equity, inclusion, and belonging looks like.